surgery. The mother unfortunately had a second cardiac arrest, and resuscitation again was commenced, and it was successful. So the surgery was completed. Again, we had a third cardiac arrest. And at this particular point, let me also mention the fact that this mother was, at this point, she was intubated. Remember, I mentioned that when you are doing the operation, normally what you would want to do is to have somebody under spinal anesthesia so that they can actually feel. This is what we normally do. So that we deliver this mother, and then we show the baby the mother, we show the sex of the mother and all that. That is basically our practice. But because this mother required help, there was an intubation that was done. Intubation basically means that the mother now is actually now put to sleep, and then there's a tube that is put inside to go all the way to the airways, so that then now the oxygen is pumped in, and then you assist the mother to be able to breathe. Again, these are resuscitative emergency measures. Again, these are standard measures that are carried out. So at this particular point, having made that a right decision for further care in terms of ICU care, calls were made to public facilities for ICU, and this includes Mama Lucy Kibaki. Mama Lucy Kibaki is a county referral hospital, and it has ICU. Kenyatta National Hospital, Kenyatta University Teaching and Referral Hospital. Unfortunately, at this particular point, the ICU beds they were all full at this point. Then the other bit, at that particular time, unfortunately, because we do a lot of cross-county work under the guidance of the governance in this country, we tried to also reach Kiambu level 5, but unfortunately at that time there was an industrial action. So we again discussed the condition with the relatives of the patient, because what normally happens is that in as much you've taken the consent, the patient has given you permission to take her to theater. What happens is that if the condition changes, the practice in the county, again, as per national standards, is that you should be able to reach out to the relatives so that then you can appraise them of the situation. And this is what was actually done. So the team worked frantically and were able to get an ICU bed at Kenyatta National Hospital in Othaya, because KNH has an annex in Othaya. But it was felt that Othaya is fairly far, and even the relatives mentioned and they declined that they would not want to take the patient to Othaya. So the reason we were doing all this is because under the Ministry of Health guidance, the emergency services, and like we do also in the county, they are basically free. Nobody can be denied emergency medical care, even as the Constitution stipulates. So the policy is, first of all, look for a public facility, because then it is easy to be able to have care rendered. And again, this is part of the referral mechanism and policy that has been put out by the Ministry of Health under the guidance of the World Health Organization. So in consultation with the family and the relatives, we also asked them if they could get a private ICU facility. And they actually told us they were able to get a private ICU facility at Abian Hospital in Isili. So they had tried also to get one at Ruai Family Hospital, Coptic Hospital, and Parklands Hospital. So Abian Hospital dispatched the ambulance, which transfers the mother at 10 p.m., accompanied by the county, by the anesthetist and the nurse from the hospital. So the patient was intubated, was under care. So up to that point, the patient who requires ICU cannot just be referred. It's not like any other patient in an ambulance. So what the team in Kawale 2 did, they accompanied that patient so that then, one, they continue with the, any resuscitative measures that will be required, and also to ensure that there's ease of care, there's that transition of care. In as much as they are done a comprehensive referral note, they make sure that they are actually also present, so that then the transfer of the patient will be seamless. So, so that is what transpired, and through the chair, if I may continue to the second question. And the second question is that whether the medical personnel and management at both Kaole 2, Level 4 Hospital and Abian Hospital adhere to establish emergency protocols, and if there were any instances of negligence or misconduct. So the response is as follows. So the medical personnel and management teams from Kaole 2 Sub-County Hospital in general adhered to establish emergency care protocols as established in the Ministry of Health guidelines and advanced cardiac life support protocol. Again, we mention the fact of the medical personnel and the management of the hospital. And because what the county has established is that any time there is an emergency that requires a patient to be evacuated, like all emergencies, the management of the facility needs to be brought on board. So they had been brought on board all along, and that is why even as the patient was being transferred to Abian, they were well aware. And basically the reason for this is to ensure that, again, all protocols are actually observed. Because when it comes to dealing with human life, you want to have as many people as possible who are qualified. You want to have all the people who can make decisions at any time. They can reach any level of support in the county done. So I would say that the emergency obstetric care procedures, including triage, timely escalation, and appropriate referral pathways were followed. So basically what we mean by triage is this. So this is a patient who walks to a facility, and you look at her and you think she can deliver normally, referring to my earlier description. Because there are patients who can come to you and you decide, no, this patient goes straight to theater. There are patients who don't even stay in the ward. They go straight to theater. Again and again, we're able to do that. That happens all the time. And the governor did mention that Pumwani Maternity Hospital, the largest hospital in East Africa, experiences this all the time. We get patients from all over the place, and you make a decision. You have to have a very good triage mechanism so that you can make that quick decision. Is this a mother who can deliver normally? Is this a mother who requires an emergency cesarean delivery, or is this a mother who requires ICU care straight away? So that is what was done. With regard to escalation, I did point out that at that particular time, there were qualified health personnel, and these are people who are ratified by the Kenya Medical Dentists and Practitioners Council, the Nursing Council of Kenya, the Clinical Council again of Kenya. So with regard to that timely escalation, because for you to do an escalation, you have to ensure that all the appropriate specialists are on board and they are fully qualified. So again, that decision was made. The decision to say this is a patient who requires monitoring of labor up to a certain extent. And then the decision to say, at this far we have come, this is a patient who now requires to have an emergency cesarean delivery. And then after that, to say that now that there is a complication, the most important thing to do first of all is to do that resuscitation. Then after that, you want to do the escalation. So that escalation means you're calling more people and you are reaching to higher levels of care and management. And again, appropriate referral pathways. I did mention that Mama Lucy they looked for ICU in Mama Lucy. Kaole 2 and Mama Lucy are fairly close. So that is why the first point of call is actually Mama Lucy ICU. If not that, then Kenyatta and the others. So again, this was done according to appropriate referral pathways. And I did mention that when the place for ICU was actually found, they sent an ambulance, and again, that is important. They have to send an ambulance that can actually carry this patient. So again, that is within the established protocols of the referral mechanism. that has been established by the Ministry of Health that the county implements. So all this was actually followed, and of course the fact that this mother was actually accompanied by the healthcare workers, not just any healthcare workers, but the healthcare workers who actually seeing that patient. Again, that is quite important. So while receiving care at the hospital, I would say that the patient unfortunately experienced a cardiac arrest shortly after delivery. And again, I mentioned that the resuscitation was done according to advanced cardiac life support and advanced life support in obstetrics guidelines. And the reason we say this is because the Kenya Medical Dentists and Practitioners Council and the Nursing Council, they only give licenses to staff who actually, one, who are qualified, and then number two, they attend a continuous medical education. That means they're able to do resuscitation.
Through the chair.
Yes.
Senator Wakoli. I think our good friend has taken us through the scenario as it were, from reporting to the ICU. And in his explanation, he was taking us through on the laid down protocols as ought to be. So I tend to believe that the second question on whether the fellas did what they ought to do procedurally as the profession dictates, to me I think is doing a repetition. So I think you can go to the next question.
Yes, thank you very much, Senator Wakoli. And in fact, let me give Kailas Daktari. I think that all portions we have understood. If you can move to where you have a Bian hospital so that we're able to wind. Remember, we have members here have a number of questions they would like to ask. And we have a couple of statements. Otherwise, we shall stay here all the way to 3 p.m.
Yes, as guided chair, let me just move to Abian, but also just mention that one of the questions that is separate from what I've actually described, and which is quite important, even as the governor has alluded. He said, the question is that whether sanitary conditions and standard of care was meted out to this patient. This was actually what was done. Let me not go into the details because I've already alluded to that. So specifically, with regard to Abian Hospital, so Abian Hospital is a private facility, as I've mentioned. It's located in Nairobi City County. And we just want to say here that its adherence to establish emergency protocols and other aspects of care can only be answered by the facility. This is a private facility.
Thank you very much.
Yes.
Even before you leave there, Pana Daktari, who is responsible for quality assurance in the facilities in Nairobi County, whether private or public? Does your team, is there a team that does inspection? So before you tell us it is private, just know that you have also some responsibility. But I have questions around that. Let me allow members to ask clarifications on some of the issues that they have raised. And we shall start with the owner of the statement, Senator Veronica Maina.
Doctor, thank you for the detailed answer you have given, response you've given to the statement. It was a very sad incident to have Rose Wangari Maina, a 23-year-old woman who's from Kangema but living in Nairobi, die while giving birth in this day and time and in this age of high technology, better health services across the whole world. And being in the capital, she should have stood the best chance and opportunity to survive through childbirth. Childbirth should never be a cause for death for any woman, least of all a 23-year-old who is an energetic mother and able to deliver a child and had delivered one child before. I have a few questions just related to the response you gave. Who gave you the detail that Rose Wangari Maina was 150?
Senator Veronica. Now, Daktari, take note of the questions because she's going to answer to us all our questions, then you will give responses one by one.
Where did you get the data that Rose Wangari Maina was 150 kgs when she came to the hospital, the Kayole 1 Health Center, the Kayole 2 Sub-County Hospital? Who gave you the detail that she was 150 kg, while in actual fact, she was 90 kgs? That's one. Number two, she was taken to theater at 4 p.m., but after delivery and after complications arose, you were looking for an ICU bed, and you were not able to trace an ICU bed in your referral hospital. How many ICU beds do you have at Mama Lucy? Are they 5? Are they 10? How many beds do you have? And because I can see there were other mothers who lost their lives in Nairobi, has any efforts been made by the county to expand the capacity of the ICU beds so that mothers can have safe delivery and safe motherhood? How long did it take you to search for that ICU bed, and who had recommended for an ICU bed in Udhaya Hospital? How did you hope to move Rose from Nairobi, cruise through Murang'a County, cruise through Kiambu County, go to Nyeri County, and locate her a bed so many hours away from Nairobi? Would she have stood even a chance if your advice was followed, the advice of your doctors was followed, to give her a bed in Udhaya? Is there a possibility, because of the errors and the negligence that Rose experienced, it exposed her to the risk of fatality, and she suffered fatally out of the whole experience of delivery, that if Rose had been given proper care, the closest you have come to admitting that there was a delay in her CS operation is when you indicated in your response that because there was another patient in theater, you could not immediately move Rose to have the CS in a timely fashion. That's the closest you have come to admitting that there was a gap in the kind of care that was being administered, that it was not administered in a timely fashion so as to save her life. But you don't seem to admit that the fact that you were searching for a bed around Nairobi and couldn't get it, your doctors even had the guts to recommend an ICU bed in Udhaya. How negligent was that?
Thank you very much, Senator Veronica Maina. Maybe now I allowed Senator Veronica Maina to ask at least all the questions she had because it's on our statement. I want to ask for your indulgence, colleagues, that if everyone can ask a maximum of 2 questions so that we can dispense with we can get the responses. Senator Sifuna.
Yeah, 2 questions. Doctor, in your response, there is an explanation that the patient suffered 3 cardiac arrests in sequence. There is no mention or explanation as to the causes of those 3 events. And secondly, Honorable Chair, you can see that the crux of the matter, and something that I think this committee should focus on, is that response at page 3 saying that all the ICU beds at Mama Lucy and Kenyatta National Hospital and Kenyatta University Teaching and Referral Hospital were full. That is where the problem is, and that is where our focus should be. Governor, there was a development that was going on there for 120 bed capacity maternity building at Mama Lucy. Kindly address yourself to that. And the one that, the neonatal ICU that had been started by the NMS that had stalled, just address us to the current situation of those 2 projects. And then I think, Chair, we should be able to get some light at the end of the tunnel. Thank you.
Senator Onyonka.
Thank you, Chair. Dr. I forget your name. What did you say your name was?
I'm Dr. Gideon Mutua.
Dr. Mutua, thank you. In most probably 1 sentence or 2 sentences, in clarity and in order for Kenyans to really understand what the issue that we are discussing today is, what actually killed this lady? according to you? Because you've really given the story and you left what is critical. She died. So can you please tell me, did she die because of a bleeding, because her case wasn't handled professionally? Did she die because, I just want you to tell me, as a doctor, what actually made this lady pass on?
Thank you very much, Senator. Senator Tabita?
Thank you, Chair. Actually, I'm just coming from where Senator Nyonka has left it. And keenly, after listening to your submissions, you presented a scenario of the general examination of this particular patient. What caught my attention was that the chest was clear. No, everything was clear in general. So what actually caused this cardiac arrest? That's where my concern is. From where Senator Veronica also mentioned in terms of the theater was in use, why could you not make a management decision then to move her to the nearest hospital for theater? If the theater was in use, why did you still keep on holding her until the theater was free for use? Because, Chair, from what we are observing, it's like the management was just reluctant. I perused the last page and you said in your response in terms of the policies when the senator asked, and you says the county cannot give any policies. When she asked the way forward, how do you manage all these problems? And you say the county has no response. That leaves a lot.
Point of order, that's not what the answer says. The question was which policy measures are being undertaken by the ministry.
You know you have been in this house and you can only speak through the chair, so you cannot just switch your microphone.
Chair, kindly permit us to...
Yes, I have no problem in permitting, but I'm only saying it must come through the chair.
Yeah, you have not been in the house for a while.
So, Chair, through you...
Let Senator David just finish. I'll allow you, Governor.
Chair, through you, the response at the bottom says the county government cannot answer on the current status of policy measures and interventions to reduce maternal mortality during and after childbirth to ensure that childbearing is safe, dignified, and not a cause of fear among women on behalf of the Ministry of Health. When we asked this question, when the senator asked as far as the county is concerned, and we believe, and I'm happy to see experts from the county, the doctor, the CEC, and so we are optimistic that they can at least be able to give at least guidelines as far as at the county level is just concerned, because health is devolved and these hospitals are at the county level. Thank you, Chair.
Thank you very much. I think, Governor, you don't need to respond on that matter. I'll just give guidelines. You know, Dr. The fact that the question was saying policy measures, interventions currently being undertaken by Minister of Health to reduce maternal health care, at least the bare minimum you should have done is to tell us what you are doing as Nairobi County Department of Health. Your governor just said in Pumwani there has been a reduction of mortality rate. We would like to know what is that you have done to reduce. So next time.
With your permission, Chair, the county cannot speak the way they are speaking, because even if there is a national government policy, they would be aware of it. At least say that we are following the policy guidelines that have been put by the Ministry of Health. These are the ones. You're not responding on behalf of the ministry, but you're saying you are aware that this, yes, this is the general policy that has been set for us to be able to address the question of maternal health care. It's not as if you don't know. You know. You are aware.
Thank you very much, Governor. I think because we have so many questions, we shall allow them to respond. But so that
you said you'll give me a...
Yes, I'll give you. So that as you respond, I want your team to also take the following questions. Overall, in Nairobi County, how many ICU beds do you have as a county? That is one. And then number two, did the officers who are transferring the patient to Abian sign the transfer forms protocol? The requirement for transfer of patient is that the physician at the hospital in Kayole 2 should first have spoken to the physician in Abian. Did that happen? So that the readiness of receiving that patient would have been established. And then, what is the level of Abian Hospital? Governor, you can take, then we can get the responses.
Thank you, Chair.
Chair, I have one more question.
Oh, sorry. Senator Bita, you can go on record and ask your question.
Thank you, Chair. My name is Senator Hamida Kibwana, member of this committee. I was just wondering, Daktari, due to the weight of this person, is it 150 kgs? So, yeah, I was wondering, maybe is it because of the weight? Then, of course, maybe there was an overdose of the anesthesia. But then, did she suffer cardiac arrest while she was?
She was not 150 kgs. She was slightly bigger than this lady.
Senator Veronica.
Don't say 150.
You know you cannot estimate weight by seeing with your eyes. Please.
Weight, your pregnancy.
Don't worry.
Through the chair.
We cannot allow that
finish my
unless you provide evidence that the mother was actually 90 kilos, which we shall allow you because you are the one of the statement.
Can I finish the
Allow Senator Tabita to finish her question.
Maybe, that's what I'm saying, maybe due to the anesthesia overdose, then maybe she could have, suffered a cardiac arrest. I'm just wondering, just a question to the doctor.
Thank you very much. Governor.
Thank you very much, Chair. Chair, we're very keen to answer questions as asked. But we will not split hairs. We can give you an additional response on the current measures that the ministry is undertaking. But also better than that, we'll tell you what we are doing as the county government of Nairobi. Chair, the reduction of mortality, which was very high, I'm sure you remember, even when you were governor, the number of issues on Pumwani, on Mamadusi, DC, that would come up every week were very high. Chair, we changed first the governance structure of our hospitals to make sure that each hospital is led by a CEO at the level 5, not a medical superintendent. A medical superintendent is good, but their training is on offering medical services. The introduction of CEOs, and you can be a doctor and be a CEO, but you must have additional training on hospital management, on supply chain management, on dealing with human resource for health, on dealing with commodities, and and facilities, how the place is it receptive, what is the best layout. There are many things if you look at hospital management science. And that has given us great success in our hospitals. The first thing I did, I can remove this because I'm not reading. Actually, it was the 20th day after being sworn in, also set up as a health reforms task force that was led by Dr. Olive Mugenda and several professionals of note in HR, Dr. Komunto, in the private sector, Anastasia Nyalita, who is now a CEC, but she was the CEO of private facilities. So there was the owner of St. Mary's, Dr. Frida, to actually come and critically look at the state of health in the city and the facilities and what needs to be done. The implementation of that is what has given us great results. While we regret the death of Wangari, which is regrettable, it is a huge, there's been a big, the numbers used to be very bad. And Chair, one of the things it said that actually embarrassed me, because I was the senator previously, Nairobi County had 0 ICU. 0. Before I got into office. There was no ICU facility in Nairobi County, owned by the county government. The only facility of ICU in Nairobi was owned by Kenyatta National Hospital, which is a referral. That is the only public ICU that was in Nairobi County. Chair, in the last 3 years, we have developed, if I count the number of ICU beds that we have, Mamadusi Kibaki Hospital are 18 beds. Yeah. From there being no ICU, 4 of the main ICU, PICU, which is pediatric, 6, neonatal, 8, from 0. Mama Margaret Uhuru Hospital now has 10 ICU beds. So that is 28. Mbagathi now has 8. That is 8 plus 28. NICU that are 4 neonatal. And by the that NICU has really saved lives because it's where preterm babies born before the babies that are born before their time. Yeah, and it's the best place I go to because I was also severely preterm. You know, so I go there and I encourage the mothers and I do the kangaroo, which now fathers are doing kangaroo. You know, sitting with the children, and that's from Kibra. Neonatal HDU is 4. Ongoing right now, we're at 90% to increase another 10 ICU in Mutwini. It's 90% complete. Actually, interestingly, I posted that today. 90% complete. And we are now moved to operationalizing. Now the ones which we've completed but are not operational. So those are the numbers that we have. It's an improvement. In 60 years of Nairobi, there was 0. In 3 years, we are at more than 30 ICU beds. But how many are enough for 7 million people? We definitely need, there's a gap. There's a definite infrastructure gap when it comes to healthcare in the city that talks about resourcing. We have 7 million Nairobians during the day and 5.5 at night. So even as we do these incremental increases, there is still a huge gap that we need to look at. And that is why, even if you look at the national government stance, while supporting public facilities, also private facilities are seen as part of health infrastructure for this country. It is true that quality control is done jointly by both the national government and the county government. We have a team of quality assurance, and that work is done between ourselves and the Kenya Medical Practitioners and Dentist Council. So we have a role. In as much as health policy in 4th schedule is set by the national government, the county also, because health is the biggest devolved function. It has our biggest staff component in Nairobi, whether it is the doctors, nurses, clinical officers, dentists, etc. And if we had time to go into the details, we'd show you the improvements there. Nairobi, we had no dentists. Now we have more than 50 that we had. Every sub-county, dental services were seen as a luxury. Today, every sub-county, there are dentists and there are dental chairs that are available. So if we had time, I don't want to go outside this statement, we'll be able to respond to that. Chair, on the other questions...
Before you leave that, Governor, so that you can finalize with a question by Senator Sifuna.
Yes.
I think I have 2 questions on complete. What was that?
Yes, there's a specific project that is mentioned.
Maybe you can finalize on that one because it looks like it's along what you are speaking about.
So and I'll ask the facilities to also prepare to give more details. There was one building, 120, that had stalled. It was part of what was being innovated. It took long. It is now with us. We made first payment of 50 million shillings. The contractor came back. He is waiting for a further payment to conclude it. We'll complete that building. That is, and the contractor I know is called Vivi Contractors or Vivi Limited. You remember all pending bills under NMS. The Auditor General was clear that all pending bills are to be paid for by the national government. But this is one case where we sought exemption because we could not wait for that delay from national government. So we went ahead and paid the initial 50 million shillings. Finally, they've novated the contract back to us for us to be able to complete it. And so we'll conclude that structure. It will help ease. The biggest, because there's another question here on congestion. The biggest relief to Mama Lucy Kibaki Hospital is actually Mama Margaret Uhuru Hospital that we're operationalizing. We have completed now all infrastructure, and it's started at a small level. We need to hire 1,500 staff, to get there. And so what we're doing, because I will again come back here and be told about wage bill, is we're moving a lot of these level 5s into corporations, so that they can have. Mama Lucy alone has 1,200 staff. Mama Lucy Hospital, that is the staff of some counties, the full staff. Mama Margaret will have another 1,500. Mutwini, if you see the building we're completing now, the number of staff also will be big. So we want to move, and that's why we have the CEOs and the boards at this high level. So then they can take off the payroll because of the 30% development and recurrent and the wage bill, ratios. They can then be off the payroll. Now that we have FIF and we've done the infrastructural work, and the hospitals then can run themselves. So,
Chair, just one thing. You notice the governor's responses never include timelines, Governor. Of the things you're saying are happening and the things that you're saying you're going to do, Chair, you'll remember it is this committee that pushed that Mama Margaret Kenyatta Hospital from the management of the national government to the county government at the request of the people of Nairobi. Now, he is saying you are operationalizing the hospital. That is not a phrase that can give anyone
It is
any
current.
idea, just a minute, any idea of what is happening. I mean, these generic terms that we employ, what is the current status and why has it taken so long? Because that issue was resolved by this committee in early 2023. We are now 2 years down the line, Governor.
I think, Governor, I was even going to just ask you, this one for completion, now that the contractor is back, what is the estimated time to completion?
I will ask the Chief Officer Facilities.
And then the one for Mama Margaret,
Yeah.
we want to know, have you taken over?
It is operating. Chair.
It's
I'm
operating.
saying full up. It's a huge hospital. So I'm saying right now, if you go there, you will be treated, Senator. There are doctors, there are nurses, but it is not in its full capacity. That's why I've mentioned the exact number of staff that need to be onboarded. But the hospital is actually working.
So
as we speak.
you would put the percentage of operationalization at what?
I can't guess.
I thought the CEC should be able to do that.
It is at
Madam,
30%. 324 staff already working over there.
we shall take a walk there.
You're very welcome.
You are a facility person to respond.
But for now,
to
there's a
the-
by-election. Maybe you wait until
These are politicians.
Can we hear about, we might even enhance the by-election. But can we hear that facility, the completion time, my friend, the person in charge of facilities?
Thank you, Honorable Chair and Honorable Members. The facility will be, because of the innovation time that took long, we are advertising for the contract to be continued from the county side. So by the end of the financial year, because we already have a budget for it that was provided in this current financial year's budget for the county, we should have the contract.
My friend, just stop there, because that answer you are giving us
It's totally different from what the
is
government
not even, we cannot even accept it. You know, gentlemen, you are, at least you have to be a little bit serious. Your governor is saying the contract was brought back, the first 50 million has been paid, the contractor was back on site. He is waiting for payment.
Chair, let me give further context. The 50 million was paid.
No, Governor, before you go there.
Yeah.
If this is the person who is responsible for facilities and you are going to give a better answer and you have about 10 departments to run, then what is this gentleman doing in that place? We expect him to give us more accurate information. You are supposed to be having a general view. If you are going to have details explaining the context and it doesn't have, then we have a problem.
In fact, Chair.
So before you respond, this gentleman must give us my friend, can you give us a proper answer? What is the exact position?
The seat you help maybe taking the seat.
Thank you, Chair. The contract for Mama Lucy Kibaki Hospital, the facility that is stalled, was innovated from the national government to the county government of Nairobi. And as mentioned by the governor, the initial 50 million that was paid was for works that had already been done during NMS. And then there is a pending certificate that needed to be paid, which is why the contractor is not on site. So that is what I'm saying. We already have a budget in this current financial year to pay the contractor so that he can be able to complete the project. Thank you.
Now hold it there. At what stage are we in this financial year? Is in quarter one over?
Yes.
Was that money in the budget in quarter one? And why was it not paid in quarter one?
Secondly, Chair, you are saying you're going to re-advertise the project, because the indication from the governor was that there's already a contractor on site and he knows the name of the contractor.
Chair, let me help the officer, because I'm the one who signed the response.
Okay, but
And I have the full responsibility.
and just take it. You know, these are the things we said. We are not going to allow people who will be coming to this committee to give us shoddy answers, and then the governor is giving us, because I can tell. I can see he's already trying to whisper to CC. That means the answer is not accurate. So anyway, just give us your perspective, but we shall make a determination on that matter.
Chair, the officer is not wrong. The 50 we paid while the contract was still at NMS. That's why we sought exemption, yeah? So that the contractor can keep going. Due to the delay of the innovation, and that was from the national side, the contract expired. So it is an EGP process to recontract the same person to complete the work. That is what he's trying to explain. We've had challenges with EGP as counties. I think that is national news. Everyone knows that there's been that challenge. We've sought exemptions to actually, on the health sector and the environment sector, to actually use the IFMIS e-procurement as well as manual way, as the case might be, because those are critical things. You can't wait for EGP to work for you to procure medicine, in your hospitals, etc. Those exemptions have been issued. So by July 2026, we should have completed that project. That one I can give as a specific timeline to the Senate. Currently.
Okay, that's better. Now, can we proceed with the other responses?
With Dr. Mutua can continue on the gynecological issues and even the weight. On the weight, when a patient comes, they're weighed at the facility. But let me allow.
Surely, Governor, you can allow the doctors to talk about the weight. In as
Senator-
much as
No, I know the
hospitals-
procedures.
Senator Veronica,
The
you don't
chair.
have the floor.
Sorry,
Chair, I know
Chair.
the procedures in my hospitals. I have 124 of them. And that's the first thing that is actually done.
Don't worry, you
But
can
also-
go and discuss that one as you have tea.
But also,
can,
Chair-
can Dr. Mutua now goes back to the responses?
Chair, I've signed the responses, so allow me to choose who to answer what part. Because
Is
it's
you
me-
has
it's
called
me.
them back?
Yeah,
So we can allow you to answer. In fact, ask one responses, and preferably always one from the governor.
Yeah.
So you can proceed.
Yeah. So, Chair, I will give him the parts that are good. If you look at what he was reading, some of them we don't even know how to pronounce because of the medical terms. Chair, the clarification I was giving was the standard operating procedure. At the facilities are actually set guidelines. And as you alluded, it is easy to guess somebody's weight by how they look like vis-a-vis by what the actual weight is. Every patient who comes has to be charged, which is the weight is taken, and that answer was given over here. Secondly, in this answer, though he will give the specific medical term, they have said the issue was the bleeding, and the pressure, the blood pressure going down that led to the cardiac arrests. Dr. Mutua, take over from there. Thank you, Chair.
Thank you, Your Excellency. Thank you, Chair. If I may proceed, I think the question of weight has been dispensed with. The question that was being
I will
asked.
give you an assignment for that weight. You are sure the patient was weighed in your facility?
Yes, the patient was weighed, Chair. We do weigh patients. And
When was that weighing scale last calibrated? Do you have a certificate from Weights and Measures?
Yes, we do. We have a maintenance plan.
That's all. Once you have answered, it's okay. Now let's make progress.
Thank you. So let me continue. So the issue of when the patient was taken.
Now let me give guidelines on how you are going to answer so that we make quick progress. Can you respond to the questions that were asked by Senator Veronica? Then we move like that. Straight to the answer.
Thank you, Chair. So the first question that was asked by the Senator Veronica Maina is about how long it takes to get an ICU bed. And right now in Nairobi City County, within 30 minutes, our referral mechanism is able to ensure that we have an ambulance in place with even 30 minutes, whether it's a public or a private facility, as long as it is a mother or a baby, and that is free of charge. So that is able to evacuate patients, whether a patient is in the hospital or a patient is actually at home. So that is the timelines that we have right now. So the other question is about the patient being referred to Othaya, Kenyatta National Hospital, Othaya. So the procedure is that you look for ICU beds in all the places that you can get. Then having done that, you have a triage to know which is the nearest ICU place. And that is where we start. And that is why towards the end, there was the aspect of Othaya ICU. And the decision making for a patient and the relatives is done by the healthcare worker giving the relative information, contextualized information. So we tell them where Othaya ICU would be. And then we tell them these are the options we have. We have looked at any other place, and this is the farthest public facility that we could get is Othaya. Hence, the nearest public facility would have been Mama Lucy Hospital or KNH. But the farthest that we were able to get at that point, having exhausted all the layers according to referral guidelines, is...
Could you kindly allow me to assist with your permission?
Yes, Governor.
The nearest available public facility, farthest would be Mandera. The nearest available public facility by radius from Kayole that was available at that point is the Mama Lucy, the Kenyatta annex that he's talking about. Just to clarify. Second clarification, the wait in time, our standard is 8 minutes, not 30, for an ambulance and for a fire engine. You know, that is the standard waiting time, not 30. That is the policy. I've confirmed from the CC as well.
Through the chair.
Senator Veronica?
Yes. I'm very concerned because what the doctor is now doing, he's giving us the hypothetical, the late procedure. The question before the House or before the committee is about rules. A response on how long it took for them to get that ICU bed. Because a specific case, a specific
Yes,
statement.
I think that's the question.
He's giving
Dr.
generalized ideas on procedures
Tell
which
us
never
so
worked
that,
that day. Rose died.
so that Senator Veronica's question can be answered, Dr.
Sure.
Would like to know how long did it take from the time a decision was made that the patient should be referred to an ICU facility? From the time the decision was made to the time the patient arrived, how long did it take? Senator Tabitha?
Senator Veronica, I would request you, as we are being given your answers, if you could just start on what caused the cardiac arrest, and then he continues responding so that we can synchronize with the answers that is the doctor is giving. Because I'm just 100% curious on what caused that cardiac, and then we drop like that. Through you, Chair.
Doctor?
Oh, thank you very much. So the cause of death for Rose, at that time we were not able to ascertain the cause of death. The cardiac arrest is a general term that we use when there's a problem with the cardiac circulation. At that time it is difficult to actually get to understand what is the actual cause of death for this patient. Because after that, resuscitation was done and the patient was taken to Abian Hospital. So the actual cause of death or what was happening at that particular time could not actually be ascertained at that particular point.
Just a minute, Doctor. You know you were given an invitation as a county to appear before this committee. And the questions were well spelled. You know when a patient dies, the last summary there gives the details. It didn't bother you to find out, now that we are appearing before this committee, to have all those details of that patient or what transpired. Remember, if you read the protocols for referral, it says the physician of the referring facility must, the ownership of that patient is at the hands of the referring physician until they hand over, and they have a responsibility to constantly keep in touch so that by the time that patient is discharged, the records in your place and in the other place, there's a closure. Did that happen? Did you check, now that you are coming here, did you check to find out what caused the death finally? If you didn't, just say no way, we make progress.
No.
Proceed to the next question.
So, thank you. Maybe through chair, as I proceed to the next question, what I also wanted to clarify is that for all patients who die, the Ministry of Health guidelines that we implement through the governor is that a postmortem must be carried out.
Dr. Let us not go there.
All right.
We have said make progress. The question that you need to answer for Veronica first so that we can make progress is from the time a decision, and I can see there are two names, I said three, who are handling. Dr. Jen Kemuntu, is she with us? She's not here.
No.
Marianne Musioko?
No.
Dixon Mutua? Dr. Did you talk to them before you prepared this report for governor's signature?
Yes, Chair.
Okay, now answer this question. We don't want to go around. How long did it take from the time the management made a decision that this patient needs to be referred up to the time the actual referral happened? How long did it take? That was the question Senator asked.
Thank you, Chair. So it took 4 hours before eventually the patient went to Abian Hospital.
Thank you very much. Now let's go to the next question.
So the next question was about the cause of death. I think that has been, we have answered about that. Again, this was also the other question that was asked by Senator Onyonka. I think we have answered that. Then we come to the question asked by Senator Tabitha. And the question was, at that particular time, when the patient was deemed to have required a cesarean delivery, what was happening in theater and why was the patient not taken to another facility? So the answer to that is that there are various levels of emergency cesarean delivery that are actually assigned to a patient who requires an emergency cesarean delivery. And that is guided by how the heartbeat of the baby is. That is guided, but whether there is bleeding or not. And according to the charge that was made at that particular time, it was actually possible for us to finish the cesarean delivery that was on the table and then take our patient to be able to deliver. These are decisions that we make all the time.
Thank you very much. Now let me ask you just a quick follow-up on that. So from the time, how long did this patient have to wait for you to complete the operation of the other patient who was in the theater?
So
please, and if you don't know, just tell us you don't know so that we make progress.
At that time, the decision, the time that was taken for the patient was 45 minutes. And we thought that that timeline would not further compromise the care of the patient.
Now let's make progress.
So the question on the policy on Abian, I think that has been answered by the governor. But if Chair, you allowed, let me also mention that what the governor has guided, because he mentioned that health is a devolved function. And what the county of Nairobi does, we do capacity building for both public and private hospitals. We train them. The other thing is that before a facility is given a license, they come to the county facility, the county offices, and then a report is given to the KMPDC. So that it's the KMPDC that further looks at the facility and decides on how they are going to be able to look at to regulate the facility in terms of its capacity. So
I asked a question. Abian is level what facility?
Abian is a level 4 facility according to the KMPDC guidelines.
Now, just remind you, as a general practice on referral, you are supposed to refer from level 4 to 5. You referring across. Was there are no other level 5 facility, even if it is private, that was available? But I don't want you to answer that. we are fairly good in the response, but from the responses we have got, Governor, what is clear is that there was delay in the process of transfer to a patient to enter ICU. 4 hours is quite a huge time. In the process, the patient could be bleeding. In the process, there could be other things that are happening. We just want you to be keen. This is a very serious matter. We have not even listened to the part of the relatives. We are yet to even listen to the part of Ambian to tell us the status of the patient when they received. But I think, Dr. It is extremely important that your teams, become a little bit efficient and fast in decision, and even helping the relatives to make decision. Some situations, relatives will base the decision on the cost, but the first thing is to save the life. We deal with the cost later. So there is need, and I think, Governor, just on this statement, you now notice, and you just said it yourself, that we need to improve the capacity of ICUs in Nairobi, especially public, for purposes of affordability and accessibility. Mbagathi is one of your big hospitals, and I think that 8 beds is too little for Mbagathi, considering the space, and at least we have visited Mbagathi. And considering also the population Mbagathi is serving on that part of Nairobi, I think there is need to improve the numbers. And when a CEO, you are here, you are also receiving FIF funds. The next thing we are coming for you CEOs, how are you spending the FIF funds? Nasikia squeezy mingi inaenda conference facilities. There is a county that they use the money to go for a conference for agriculture. So please, I think that you will allow us, we shall make once we do our report, we shall inform you of what we shall have decided on this. But those of you who are involved in the management of health, not the gaps that we are seeing from this presentation. Because of time, we would like to move the statement by Senator Sifuna for Nairobi.
Chair, kindly just allow me to say one thing.
Senator Amida, in 1 minute.
Yeah. Gava, you remember this is not the first case. Remember we even of such, of course it's very similar, yeah. You remember even the mother who died and she had delivered twins. The first one actually we had, I think, was it in 2023? And many others. Can you imagine the untold stories, of the deaths of, of high, mortality, maternal mortality deaths in Mama Lucy. So I think there's every need, maybe to up their game for the Mama Lucy, because we've always have many other issues of death, maternal mortality.
Chair. Yes, Governor, you can proceed and also go ahead to...
Yeah. Chair, I think it will be fair to give you the trend of mortality rates, which is an official national, it's a document available publicly. There's been great reduction in maternal mortality, Senator Hamida, in Nairobi. Nairobi is possibly the lowest in the country, and that is from a position where it was not low. The numbers were very high before. But of course, one death is very emotive. One. And even saying that, you see, if you look at the size of, for instance, Pumwani, the biggest in East and Central Africa, having only 2 in a year. Remember, some cases there are pre-existing conditions. There are a number of factors. So, Senator Amida, we will be able to give you the trend for you to say whether there's been improvement in maternal services in Nairobi or not. So it's not my word for it. Chair, on to the question by the Senator. The first question is why CHPs have not received essential personal protective gears such as gloves, raincoats, gumboots and masks necessary for their safety and professional work. The second is the measures to address technological support gap, delays in remitting stipends. I'll ask Dr. Ngunu to take the first 2 questions. and then we can take it from there. Dr. Ngunu.
Thank you, Your Excellency. So for the first question, if you look at the Nairobi City County CHS Act of 2019, Part 3D, we have committed through this act to for the protection of the health and safety of all the community health promoters in Nairobi County. We are currently implementing a performance-based stipend with a tool for measuring performance that is carried out every month using the electronic community health information system. And as a result of passing that at 80%, we are able to remunerate the CHPs at 3,500 shillings, which is above the match of 2,500 shillings we are provided for by the national government. This supports them to a minimum extent. However, the county, also in collaboration with other development partners, is supporting them with the primary protective gear, and in case in point, the gloves and the masks. We are also...
just a minute, Dr.
Yes.
I'm lost in your response, because we want to move a little bit fast. The question is saying, explain why CHPs in Nairobi have not received essential personal protective gear such as gloves, raincoat, gumboots, and masks necessary for their safety and professional work. Chair. Address yourself to that.
Chair, what if the question is wrong?
Pardon?
What if the question is wrong? You know, if you ask, explain why they have not received, and she's explaining that they have received, and this is what we give them.
Chair,
That's a minute.
because I am the one who wrote the question, it cannot be a wrong question, Governor. For a bit of background, Chair, you can see this is a very old question. We had a meeting with CHPs from Nairobi's 5 constituencies on 16th of December 2024. This question originated from those conversations we were having with them. As you can see, the question was brought before the Senate on the 13th of January 2025. This was out of the conversations we had with the CHPs themselves. Now, the question is not talking about masks. These people, you know the environment in which they operate in, including the informal settlements, and when it's raining, Governor, the way that it is raining right now, they are saying there are necessary tools for them to be able to do the job. Gumboots, raincoats, and gloves. So when they say we need these things to do our job, that question cannot be wrong.
Chair.
Yes, Governor.
With your permission. The reason why I said it is wrong is because, and there's a standard of what is in the kit that is set nationally. This is additional. So it's the right question. Why don't they have now gloves, raincoats, gumboots, and masks? They are given case by case, depending on what they are sent. It is not given to all of them, because you see, they cover 782 households. That's why there are 700 and how many households? 782,000 households. That's why there are 7820. And not all of those areas throughout the year would require gumboots and gloves. Beyond the standard kit, because remember, there's what the national government is doing in the county. All counties are matching 2525. But Nairobi, we increased it. We're doing more. We're doing 3.5. Where there is need for additional, Chair, and the director will give more details, we actually provide, but it's not a standard provision for all of them at the same time. Maybe you can clarify. I hope I'm not wrong on that. That's from what I know, but just clarify.
Governor, you're exactly correct. In the case of what Senator has asked about the gumboots and raincoats, we did a procurement in November 2023 as Nairobi County Government, and we were able to supply 1,200 of them with these commodities in response to the cholera epidemic, which we were able to control as Nairobi County. That was running then. We are able to give commodities, and particularly those around WASH, and these are commodities around the WASH response, to the CHPs whenever we have any outbreaks, and we do this with support from the county government budget as well as development partners. When it comes to the CHP kits, we receive this from the national government. We have accounted for that, and we have a distribution list of how these kits went to the CHPs.
Thank you very much.
And so,
let me help you so that in future you frame your answers correctly. You know, we are not asking for very complicated answers in the Senate. Why don't you just come to the Senate and say, you have asked about this, give us details and say, we have supplied 1,200 CHPs on this particular area, in this particular period, with the following commodities. Okay? There is no competition here. This is just feedback from the CHPs who are saying, we want to work for Nairobi County better. Some of these places are not accessible, we need gumboots. This, just direct answers. If you say under WASH program is a complete another different program. We cannot wait until there's an outbreak of cholera for us to supply them with gumboots. It's raining every day in Nairobi, So what we are saying, I've had your answer, but please, I can tell you, Governor, the problem with some of the answers we are given, and sometimes we sign them off, it starts with perception. These questions are being asked because I'm being fought, those things. Please, Daktari, you have good answers, but you see you have not collected your data well. Just provide data and evidence. It solves our work. In short, one look at your budget, one look at your procurements. You know you are Nairobi very well. We know the season we are in the country, where they need to be facilitated with gumboot, facilitate, and we agree with you. Not all places require those commodities, so give those who deserve, so they can give you a better service. Can you go to question number 2?
Chair, just before you go to question number 2, there is an attitude from the Nairobi County government that they can be clever with words and they think we will not know what they are saying. Because what she is saying is they went out to buy gumboots after or during a cholera outbreak. You have a full complement of 7,400 CHPs, Governor. 7,400. You know their job description. You have sent them out into the estates to do this work. There are certain basic things that from the beginning you would think that they would require. That's the whole point. If even for you during the campaigns when you sit with these CHPs, the question of gumboots has always been there. From 2017 to 2022, you talk to the same people that I talk to. So the expectation is, if you can tell us of the 7,400, 4,000 don't need them because they work in I don't know which area of this is Nairobi that you think that they will not need gumboots because when Nairobi floods, it's all over the place.
No, they're not on the...
That's what I'm saying. So you will tell us of the 7,400, we have provided 4,000 gumboots for the people who work in these specific areas because of the sort of hygiene issues that are there. If somebody asks for a raincoat, Governor, which ones will you give raincoats and which ones do you think even if they are rained on, it's okay?
Chair, it's such a simple issue. We shouldn't split hairs.
No, it's not a simple issue. The reason why we are splitting issues is because you've decided to split issues. The response that is coming from her, she decided to tell us that they bought 1,700. She needs to tell us for whom, as the chair has framed. So can we have a conversation? Are these things that the county government thinks are necessary for these CHPs to be able to do their job? And if they are, then we say only 3,000 of them need it. These ones don't need it. And if you can be able to give us that breakdown of what has been done. So unless there is another cholera outbreak, can the remaining 6,000 or so...
I think you have made your point, Senator Sifuna.
Gumboots.
Let me just allow some small clarification, then we go to the question number 2.
Chair, we'll give all of them.
That's enough.
If there's someone who has actually in your answered, the issue of even giving CHPs in Kenya a stipend was brought by me in this house. I believe in the work of CHPs. And we were the first county to give them a stipend. And our stipend is the highest.
Now you
so if something can give them, just allow me to answer. If something can make them work better, I'll be the first person to do it. We shall provide additional. What we said was the essential, the basic essential that's a national standard has been provided. We shall do more. I think it's a fair case, and we shall do it.
Very good. Now let's go to question number 2.
Number 2 was the measures being taken to address technological support gap. Chair, long and short of this is that we have 7820 CHPs. The provision by these devices are being provided from the national support. They provided for fewer than they are. So there's been a push as COG because it's throughout the counties, it's not just in Nairobi, because you want standardized equipment. And so that procurement is being done at the national level. I think the support from one of the organizations, is it CIF or who is it? One of the...
Yes, it's CIF, yes.
Child Investment Foundation Fund are the ones that procured that for the national government. So they will bridge that gap for all CHPs across the country, including Nairobi. The next question.
So maybe, Governor.
Yeah.
So how many were provided for Nairobi?
7,000.
Because then it makes it possible for us to make a follow-up with the ministry.
Yes, thank
because
you.
it's their work.
So 7,502 were provided with that, with the devices. The gap, therefore, is the difference with 7820. That's a difference that we. So it's been tabulated for each county how many need to be done. We will be very happy if the Senate can assist and we can provide the list from COG for all the counties, because it's also not neat and clean and fair for them. You're working, one CHP has this device, another one doesn't have the device. Remember, the national government also got over 100,000 CHPs. There are more than 100,000 CHPs in Kenya. So that is why the gap is there.
Yeah, Chair, the question also covers the qualitative aspect of the devices themselves that have been provided. The conversations with the CHPs that it is old technology. Most of the time it's unreliable, it's failing. So maybe you can address that as well in terms of the quality of the technology itself to be able to do actual online reporting. Because when we were with them, the demonstrations there, those phones hang 90% of the time, Governor. And it makes their work very, very difficult. So maybe you can address that as well. Instead of buying the machine for chapatis, maybe we should buy iPhones for the CHPs.
Senator Sifuna, you are out of order.
Sorry, I didn't hear
that is a completely different program that doesn't even fall within the mandate of this committee.
What it is?
If he has anything to ask about school feeding, he should go to the Committee of Education.
No, it just shows that it is lunchtime. Something, anyway. Chair, you know this ICHIS program is national. The ones providing the software, the devices, some say even the bundles. And Chair, we have been insisting as COG and as counties, just leave that entire thing to counties to do, because we can provide software, we can then look at the quality of, it should be left to us. I'm glad I've seen what you passed recently, that you've put the entire now stipend from the national government as a conditional grant to come to the counties. Because even to the next question, there's no delay of stipends from the county government. We never delay, not even once. There's no month that they have not been paid. But the national component sometimes can take 2-3 months and then it comes in lump sum. But the county one has never gone beyond a month. Sometimes it might be late in the month. Because I said it very clearly that no CHP, or rather that I, as a governor, will not be paid before CHP has a stipend. We're on the same payroll. So I am paid on the same day, the CECs, the directors, and the CHPs. We're all paid on one payroll on the same exact day. So, again, it's something the committee can take up.
But I think that is okay. Now that we have put as conditional grant, it will all come. So payment.
But see, that's just the money. Now the software, the management, the scoring,
what
the
we need
tasks
to
they're
do
given.
now so that we can help you. I think now ask your chair of that COG to give us a report.
Oh, good.
So that we are now able to follow up. In fact, two things. So that we are able to help address that issue of CHP. Let us get the data on the number of CHP without the kits, so that we can follow up with the ministry to exactly provide. Then do the challenges they're having in terms of technology and so forth, so that we can follow with them up to upgrade. And your proposal as a COG in terms of it being left to you, so that we can still pursue the same trend of making that provision of resource a conditional grant, so that it can now be managed from counties. That's why there is need for collaboration between COG and us. But your chair hardly comes to any meeting called by the Senate, so you have to come to Senator Sifuna so that we make progress.
Governor, there is a question that I was asked to specifically put to you by those CHPs. They understand that the component that delays is from the national government component, right? And county governments, I think including yours, whenever the disbursement of equitable share delays, you have found ways to make sure that you pay your people. That's a fact. Why are they not included in the similar program so that you are able to pay them the full one, covering even the bit by the national government, and then when the money comes, you're able to deal the same way you deal with salaries when there is exchequer delays?
We can look at it for the government component when it delays. The only issue that I foresee we would have is COB approving that difference, but it's not a big amount. It's something we can explore, definitely. Yeah, so that we can cover for national when the money comes. But now that it's a conditional grant, again, the exchequer delays really hold counties back, But covering for the national government 2.5, if COB allows, we can be doing it. And then when the money comes, we now take it back to our CRF for other purposes.
But I think
that's a very good idea.
That now you can explore that. Now the last question there.
These are things that we should even just be discussing because it's such a good idea.
Don't make me make some comments.
This is why we want you to be coming to the
struggled to avoid
more often.
No, Sifuna has just said it, so let's make progress.
It's a good
The last question.
Chair,
Sifuna.
these conversations cannot happen anywhere else, Governor. This is why we insist that you come here.
It's good.
We exchange ideas.
Thank you.
Chair, I wanted to say the same thing. I think Governor, being Senator Emeritus, I told him the other time he needs to use us, the health committee or whichever committee. He's been here before and he knows where we can support, where not. So I don't know why he's not taking advantage of us.
I think that's why he's here today. Now let's make
Can I
progress.
also come on my own motion? Suomoto.
Yeah. You can invite us a committee. What's wrong in having an engagement?
Yeah, because
Nairobi carries 7 million people. It's a very significant population of this country. Almost actually 10% of the population of the nation. So the health of this city is extremely important. So can we have a response to question number 5?
Chair, on question number 5, no, there was number 4. On why CHPs have been required to conduct SHA registrations for the public without adequate facilitation. That's an issue they have raised. It's an issue I've also raised similarly at COG. I feel that, you see, the 2.5 that comes from national shouldn't just be an assumption that then they take on any other additional task. Because, Chair, taking care of 100 households for one person is actually a task. And this network of CHPs is so critical because they know this house has this issue of diabetes, this other house has this. So there should have been some facilitation.
But Governor, I agree there should be some facilitation. But how about if we ask the CHPs, just in the 100 households they are taken care of, ensure the 100 households are registered in SHA.
That's what
so that as they go about their work, in terms of checking on these other things, they also make those inquiries. But I don't, of course, we are not saying they don't deserve additional thing, but it also enhances the healthcare, provision.
Chair, this, things improve with time, When I came to this house, we had 15 billion. We left it at now 18. My Senate has pushed it to 20. Chair, CHPs were getting nothing. I brought a motion. We started as Nairobi. Now they're getting something, 3.5. Ideally, CHPs should be at minimum wage, if you ask me. Because they're no longer volunteers. They're actually workers. They actually do meaningful work. If it was up to me, we would have a conditional allocation to all counties for CHPs to be at a minimum wage, because of the work they do. Then you can give them different tasks. The same way, my staff here, yes, they have their JD, but I can give them different tasks alongside health because they have a full salary, So that would be our proposal, Chair, moving forward, that CHPs actually moved to minimum wage. The next question is efforts to enhance training for CHPs on use of electronic community health information systems to ensure efficient reporting and awarding of marks. Chair, we have the CHPs report to CHAS, Community Health Assistance. We have employed additional, we've promoted actually some of the CHPs who've shown leadership. They've shown ability to manage teams and to train others. So those ones have been promoted to actually be employed as community health assistants. These ones are now as county employees. They're trained on the system, and so they serve as the supervisors. They're providing mentorship, coaching, training on ICHs to CHPs on a day-to-day basis. Chair, in one of the mental health, trainings that we had with the CHPs, and I tell you, I really love the CHPs. One of them said that their stress goes down because I'm in their WhatsApp group, and when they raise issues, I can see. Such things actually help us because mental health is big for them to be, at a good mental space, and that is what Dr. Kunu told me that. I hope it is true. Yeah, but I'm on the WhatsApp group with them, and that's what they said. And so I think that brings us to the end, of that question.
Thank you very much. Now, we have two statements that are related. The statement by Senator Amida Kibwana and Senator by Thabeda. All are dealing with Mama Lucy. And they are not, because Governor, we want to try and dispense with this so that new statements can find their way into the House. Can we have responses? And I think these can be handled together. They are more of similar questions. We can have just a comprehensive response of the two questions by Senator Amida. The question by Senator Mutinda is on state the total number of women detained in the hospital facility due to inability to settle maternity fees, stating the respective amounts owed, state the payment modalities or options in place set by the hospital management for defaulters, explain the protocols followed by the hospital management in the event a patient is unable to raise maternity fees. The one for Senator Mida is asking for a report on the extent of overcrowding and strain at the Mama Lucy Kibaki. Outline measures taken by the county government of Nairobi to address overcrowding, and then clarify the steps being taken by patients. Patients are not unfairly charged for services they are unable to access due to current constraint. Recommend measures on how the national government and the Ministry of Health can support the county government of Nairobi to improve. I think those, since you have written responses, you can give us just a whole summary of you and just allow senators to ask if there's a specific question they want to deal with.
Thank you, Chair. And Chair, I agree. Now that we'll exhaust all of this, and I want to commend your clerk, Humphrey. He has found a way to be able to communicate better with our county, such that we don't have the backlog that we had before. And so whatever comes to this committee, Mr. Ringera, who was my campus mate, will be able to make sure we dispense with very quickly, Chair. Chair, the issue of detention. Number one, we don't detain women in facilities. It is the waiver period and process that takes a bit of time. And that is what we are refining. Because you find people, ultimately, and you've been a governor, facilities cannot run if payment is not made. And that is why we tell people, please register onto SHA. Register onto SHA so that you can be covered. But you see, also keeping them for long is a cost, because you have to feed them. They're taking space others would have taken. But imagine if everybody who says they can't pay is released immediately. All facilities will collapse, Chair. If people had the option of not paying, they will not pay. Even those who can pay. So, Chair, we have a waiver guideline, we have a process of waivers, partial waiver or full waiver, that hospital by hospital we do. Chair, when I go to those hospitals, and the CEOs will tell you, even those who could, all the women, they come running and they say, oh, Governor, tumekwama hapa. Sometimes it is not true. They say there's been there for 3 months. It is not true. I don't waive for them. I pay. The only difference is, Chair, I don't put it on media. And I think people should stop carrying cameras to hospitals. You're going to see someone in a hospital bed, you're there with their camera, you're looking at their leg. It is very indecent. It takes away the decency, of that patient and the dignity of that patient. You must respect their dignity. So, Chair, that's the waiver system we have. We will keep on doing campaigns for health insurance, because health financing is a critical aspect that this country needs. And I'll tell you an example. Today, in my level 2s and 3s, my primary healthcare facilities, I think I will invite you to come to Embakasi South or Embakasi East. You can go to Tasia. We can go to Kwandege, what do you call this? Kware dispensary. Kware is now level 2. All my hospitals have assigned, you walk in and walk out. If you're not registered, we register you there and then. Because PHC fund, imagine that hospital that was just like 2 containers is getting 1.7 million shillings a month at the minimum. The PHC is working perfectly. The problem we have is on the level 4s and 5s because of the SHA reimbursement that is taking a bit of time. But for the lower levels, and many people are also not being told, and I'll ask the SHA team, I think I saw the senator here, the CS here, and the CEO, to explain to people that you don't go directly first to the level 4 or level 5. Because those who go there are the ones who say SHA is not working. Because it is based on a referral system. You start at the lower level, and then you're then guided on where to go to. Those who do that have a seamless experience. I know people who've been paid for 300,000, 400, 180. In fact, the number of harambes that we are being put into for health have actually gone down drastically. So here on the issue of bed capacity, again, a city of 7 million people, the bed capacity required is tremendous. But I keep telling my CEOs, they have become victims of their success. People are coming to our hospitals because they know that is where they're getting good care. And that is why they're flocking in there. So we are continuing with infrastructure improvement, building more wards, hiring more doctors and nurses, because you must give that care. But the policy is you cannot turn away a patient. If a patient comes, you cannot tell them, no, the beds are full. Please, and that person is maybe even critical, or they're about to give birth. Do you turn them away? You don't. But the turnaround time is high. And that is why, for us to prevent that, those who have been cleared with are discharged as soon as is possible. We have those infrastructure projects. I have shown you Mutuini, which is going to have a huge bed capacity. Is it 300 or what? What is it? Mutuini? Mutuini, which is Mama Rachel Ruto. Mutuini will have 400 bed capacity. Mama Margaret is also big, 425. Mama Lucy, this facility that my senator was talking about, is adding an additional 120. And also there's another 300. So we're expanding. What I would ask for the support that Nairobi County needs. Chair, in the same way, we saw that in education, Nairobi needed affirmative action. That a county like Nairobi from 1992 had no new school built. With 7 million people, had only 210 primary schools. You can compare with your county. You know how many primary schools you had, because my guest of honor on that day was a former MP from Eldoret, was in Gishu, former Eldoret North MP, who is the president currently. And he said when he was an MP, he had 150 schools in his constituency. Nairobi with 17 constituencies had only 210. The same affirmative, and because of that, they did affirmative action in the budget, added 1 billion every year for 3 years through the members of parliament to build classrooms. It's the same way Nairobi would require affirmative action to increase bed capacity in public hospitals and public hospitals. Beyond that, we'll have the same story of women sharing beds. We increase the number of beds. We cannot turn them away, Chair. Chair, I think that generally covers.
Maybe one
issue of
question,
capacity.
because I visited Mbagathi and your CEO is here. There's a very big facility that was left by COVID in Mbagathi that was not in use. Bwana CEO, is it in use? Ama wasasa umengoa?
Honorable Chair, it's not in use. We engaged the public health sector, and that space has been condemned. But we are putting it into a better use of a center of excellence in maternal and child health.
Okay, Senator Onyonka.
Thank you.
Thank you, Chair. Governor, my question, I don't know whether, Chair, I'm preempting what you wanted to raise. I'm just interested to know, how has your FIF performance been? Has it been increasing? And in your responses to the questions I've had, which have been asked, I just heard you say the national government is doing this and this. Other than the constructions you've done and the projects that are standing, how much is your FIF helping? And as I said, has it increased? Is there a variance and that kind of thing?
Senator Amida.
Oh, no, Chair, you realize, I think, Nairobi, I think it's long overdue, Chair. I would just propose for us to go for inspection, simply because just to support all that. And you remember, even this questions, actually, I think we haven't seen Gava for some time, because these were since 2024. But one more thing, Governor, there was a motion that went through my motion on postpartum depression, having a mental health wings. We've gone to many hospitals, and I think, of course, Nairobi being one of them, that you find mothers who they have lost their babies in the same wing with the ones who are breastfeeding. It's really, they fall through, they go through depression. So mental health issues. And I said, I'd requested, the postpartum depression who are going through that, can we have a separate wing for them in every, county for them? And then number 2, yes, inspection. Then one last thing, Bwana Governor, let's take advantage. I think we've been having even many investors who have been interested to build hospitals. I don't know whether they've approached it. So in case we have, and maybe we have been having many proposals on that, why don't you take advantage? At least the legacy for you in Nairobi is healthcare. Health is wealth.
Yes,
so let's take advantage of
that. Governor, 1 minute response.
Thank you. Chair, I agree. I agree with Senator Hamida and also Senator Onyonka. Number one, we have to be creative. There are many partnerships that we've sought now. We're working with the Swedes or Novo Nordisk guys for the Danish, sorry to their country, on the issue of diabetes. And you'll have a center of excellence. The first research hospital public research hospital is going to be Mbagathi, working in partnership with Kemri. So that even these who are doing great medical research can do their clinicals within our hospitals. Chair, if you look at Mama Lucy, now it has an annex in Umoja that is the first public eye hospital where we're even doing admissions, we're doing surgeries. That had never been done. We're manufacturing the spectacles from there in Umoja too. And I would wish you come see it. There was an old man, and I always give this story, 91-year-old, he had not seen for 50 years. He went to Umoja 2 when we were launching. We gave them 1 month of world-free services. He regained his sight. And he started saying, I'm not going to leave this hospital. Because he felt if he leaves that fence, the sight will go back. That he's only seeing because he's in there. And you could see him asking his son, Kumbe, you look like this. I thought you were more handsome and what, joking. And there are many such stories. Regaining sight, now you're finding people from all over the country are coming to Umoja 2. They know the matatu to take to reach Umoja 2 because of that eye hospital. I've talked about dental services that we've increased across the county and dental chairs that were never there. Many of us never went to a dentist growing up. We thought that's for rich people, God has helped us that we can still smile, But there's such transformation when you change governance. On PPPs, we're working on one currently in Isili. Isili, we have beautiful land, big space, abandoned facilities. Investors have come and said, look, we want to partner with you. We put up a hospital, public hospital to the level that you want, and allow us also to have our own private wing. It makes sense, We need to do the same for expansion even of the Nairobi Funeral Home. Because the same quality today you're going to get at these private facilities, whether it is Montezuma or whatnot, let me not mention the brands. Today, if you go to Nairobi Funeral Home, remember the smell that was always at that roundabout. Always. It has improved tremendously. It's called Nairobi Funeral Home. But formerly known.
Is the generator working?
Formerly, there are many generators. They are working. There's even now a chapel.
Now, let's make progress, Governor, because we have one more statement.
On the final one.
Let's finalize that so that
FIF. FIF is extremely important. One aspect that I raised, because I called all the facility heads to chat out City Hall. And what one of them mentioned made so much sense that now they have to do accounting work that they were never trained to do. Because they have to account for all this money. And we have now been taking them to courses, training them on these financial management skills. There is a no cash policy, so we've sealed the leakage. The FIF has gone up. There's no cash policy. All of it is paid through the system and retained at the facility. That's why I could give you the example of Embakasi South. A small level 2 getting 2 million shillings a month. Now the story of shortage of drugs is a long forgotten story because you have no excuse. And the Wananchi's interaction with the hospital to know whether it's working or not is not whether there's a doctor. They never know whether they see a doctor. Actually, most Wananchi don't see a doctor. They see a clinical officer. If they see someone in a lab coat, that's a doctor. But of course we have doctors in our facilities. The test, the pudding in healthcare is kama kuna dawa or if there's no medicine. And once that is sorted out, we are seeing the public now, more of them coming to our facilities, Chair. Chair, I can leave it at that.
Excellent.
Yes, Senator Onyonga.
Governor Sakaja, if you to listen to what you've said, and I remember I've attended functions, committee meetings where you've sat up like this. I live in Nairobi and I don't know what you've said is true. So is it possible, Chair, if I could make a request that you allow us at least for us to go and verify that what you're saying? Because if this is what you've done, then I don't think we should have much issue.
Senator Onyonga, we don't need the permission of Sakaja to go to any facility.
No, what I'm saying, Chair, is that in case he's going to have the by-elections, you know what I'm saying, he might think we are going to look for votes. So we just want to visit.
The facilities are spread across
the 60 other sub-counties
exactly.
that don't have a by-election.
Yes. Now, members, because we have only one statement from Senator Okiomtata, I've gone through the statement, and I think we can still dispense with this statement before it is 2:30. I think we shall have cleared our books with the county government of Nairobi. So I'd ask Governor, a statement was sought by Senator Okiomtata, the senator from Busia, and I have seen the team from Bagadi were here. I think this can be adequately addressed. I've also gone through the responses. There was an allegation of abuse of medical bill waiver facility at Bagadi County Referral Hospital, including involvement of hospital staff management in the said malpractice. Then number 2, the veracity of allegations of threats, intimidation against staff and patients and their families, and indicate measures in place to guarantee safety and protection. Then number 3 is audit of collection of parking fees at the said hospital, determining whether due process was followed in the introduction of the charges and clarify how funds collected are utilized. The mechanisms the Ministry of Health has put in place to monitor and ensure proper administration of medical bill waiver facility in public hospitals across the country. But I think if you reframe that within Nairobi County, you tell us what you're doing about it. And then number 5, whether there are regular audits of public hospitals specifying whether Bagati County, I think the rest of the audit we shall deal with the ministry. But we also want to know from the departmental level of your county government, do you do regular audits to your facilities? So I think if we can get those responses, I can see the CEO is already positioned himself, Governor.
Yes, Chair, I'll just give a general overview and the CEO can quickly run through it. Chair, our intention, as I've said, is to enhance autonomy of the hospitals, especially the level 5 going up because of the potential that they have. Chair, a hospital ideally should run itself. If you go to any private hospital, even if the charges are a bit higher, they run itself. Lab is profitable, the issue of medicine, etc. And that is where we're moving to without overcharging the patients. And Mbagathi is one example of a center of excellence in the country. In fact, the CEO has been receiving delegations from other parts of the country to see how certain things are being done, and he can be able to explain that. I think the last team was it Nakuru, on the issue of neonatal ICU. So, Chair, the waiver process has been outlined, and we've given the sample waiver forms and the process that is undertaken to provide the waivers. The issue of intimidation, and we needed more information there. The answer is that the allegations are not true, but the hospital has an anonymous incident reporting system, and we encourage, and that guarantees safety and protection of whistleblowers, including, if something must be escalated at City Hall, there is actually provision to write directly to me, and I'm the only one who opens those letters. No one else opens those boxes. I'm the one who personally goes around to open. The audit of collection of parking fees, whether due process was followed, introduction of charges. Chair, we have 2 hospitals where we have to introduce parking fees because people would come, leave their cars, and then go to town. And so patients or people who need services don't get. So Mama Lucy Hospital, which now the parking was full throughout, of people who are not seeking services, including even sometimes matatus, previously, as well as Mbagathi Hospital, that has had to be introduced.
Before you leave there, so that because we are short of time, Now, those parking fees you are collecting in Mama Lucy and Bagade, I hope the revenue is going to the hospital.
FIF direct.
FIF.
No, not to the county.
Yes.
That is FIF. They did a revenue share model with the person who installed the equipment.
That's okay.
So
As long as whatever is due is remaining
is
in the
there.
facility.
And soon I told these CEOs of mine, I will stop paying their doctors and nurses. They must take over that payroll. So we are seeing the growth of these hospitals. These hospitals can actually stand on their own. Once SHA is fully, the reimbursement is guaranteed on time, we can be able to move all of this stuff to the payroll of the hospitals so that we can have, them as almost level 6, but not in terms of speciality, but in terms of autonomy. So CEO, whatever I might have left out, kindly.
Chair.
Why don't we allow the CEO to finish so that we can discuss?
Okay. Thank you, Excellency. I think, Chair, Honorable Senators, I have nothing to add. His Excellency has addressed everything.
Chair.
When I see you, that's a joke of the year. Now, there are only two specific areas the governor has touched on. I expected you to tell us something about the issue of audits, whether your facility has been audited. Do you have any report? I also expected you to tell us that now that this revenue is coming, how are you utilizing?
Thank you, Honorable Chair.
And on the issue of, I don't want us to wish it away, Governor. On this issue of allegation of malpractice, I think you must speak to it, Pana CEO. It cannot just be, Senator Okia Mtata is not an ordinary man. And he's a lawyer who is not trained. And he does extensive research. By the time you see a statement, just know there is information. So I think clarify whether there have been such incidences before they have been dealt with and what is the position. I think that one line sentence is not sufficient.
Abu Chair, well guided. On alleged abuse of the medical facility, the response is false, it's not true. There are controls to ensure accountability in the process. And to achieve this, Honorable Chair, is that the medical facility is managed by a standing hospital committee, which comprises 1, medical social work in charge, the ward in charges, these are the nurse managers, the overall nursing services manager, the hospital administrative officer, and the hospital accountant. Honorable Chair, Honorable Senators, the beneficiaries of this facility are identified among both outpatients and inpatients, and mainly include patients not registered with SHA, street families, gender-based violence victims, patients without social support, mostly from slums, and the wrong-state discharged patients. Honorable Chair, Honorable Senators, the nature of these waivers are in 2 categories, namely full waivers and partial waivers. Roman 1, full waivers. These are patients who cannot raise any amount to offset hospital bills. Roman 2, partial waivers. These are patients' bills partly paid by SHA but cannot raise a balance, or the patient or the guardian able to raise a percentage of the hospital bill. In this case, a favorable amount is paid directly to the hospital account, and an official receipt is raised, and the remainder of the bill is waived. In both instances above, Honorable Chair, the committee determines the applicable criteria through a vetting process in partnership with relevant community health promoters, area administrators, mainly chiefs, religious leaders, and political leaders, mostly area MPs and MCAs. Once the waiver committee makes a determination on either of the above, an official waiver form is issued to the beneficiary bearing patient's information, signatures which imply approvals of the committee membership, and a record of the beneficiaries is filed and kept by the Hospital Medical Social Work Department. After the management executes this process, it is subjected to the Hospital Board of Management on quarterly basis for audit of the process and ratification. Question 2. The veracity of allegations of threat and intimidation against the staff. Response. The allegations are false. The hospital has an anonymous incident reporting system that guarantees the safety and protection of whistleblowers. And this is addressed by a committee who opens the boxes and analyzes issues raised. Question 3, Honorable Chair, Honorable Senators. An audit of collection
The department. Let us not go far. Waziri, how many times has your department audited your facilities? When was Mbagathi last audited?
We audited Mbagathi last year. That is the year 2024-2025. The audit is currently going on. We submitted the 2023-2024 to the county assembly as well. So it's audited annually.
Thank you very much. Senator Onyonka.
Chair, thank you. I just have two small issues. The MD of Mbagathi Hospital, I don't know whether it's, yes. I wanted to say that thank you. Chair, I've had cases of my people from Kisii who have been having challenges with the treatment of certain diseases, and he's been extremely very welcoming. And I've also seen your facility, two recommendations, and Governor is here. Governor, I've noticed that many of the projects we do, either as a country or as a people, we never keep any maintenance money or maintenance teams to clean up the facilities and keep on repairing them as we use them. I don't know what you are going to do about that. And the final one, I sit in the finance committee, and one of the recommendations that was given is that we need to have internal auditors in all these facilities that you're running who will be having frequent audits in order to try and manage and control the use and the management of your facilities. Otherwise, Chair, thank you so much.
Before you respond, Madam CEO, I've looked at the revenue sharing agreement for parking. We are only getting 30%. Why? And for how long? When is the revenue sharing going to be 50-50? 30% is on the lower side.
Thank you, Honorable Chair.
Let's Senator Kamau, so that you can respond to all of them. Senator Kamau.
Yes, thank you very much, Chair. I wanted to ask the Governor, now that we are in the process of encouraging people to register for SHA, I just wanted to know what is the number of registration of Nairobi County, the people that have registered on SHA.
You can respond.
Thank you, Chair. As I get that number, the CEO has mentioned, and the question that has been asked about the quality of the service. I'm glad Senator Onyonka's people go to Mbagathi. I want to tell you, Chair, I myself have been treated there, and my father goes for physiotherapy there. It is at the same level as any other hospital you'd go to in this capital of Nairobi, whether it is the private ones which have been known for a long time. The level of quality I got there. In fact, the doctor who saw me, what was his name?
Dr. Masini.
He is one of the best, you know. His specialty is in orthopedics.
Orthopedics.
He's in orthopedics. I had an issue where I fell from a motorbike. But, and don't ask me the context. But, because I ride bikes. He treated me so well that I've kept going. My dad does his physiotherapy there regularly. He leaves Kitale, comes to Nairobi, straight to Mbagathi. And he says he doesn't want to go to the other hospitals I used to take him to. And we need to encourage that use of our public facilities, especially by public officers. Because the same quality I expect my person from, Kibra, which is next to Mbagathi, of medical care to get the same quality that I should be able to get for myself and for my children. Now, the problem with the children, they're not ours alone, they have mothers, and their mothers have their preference. But it was up to me, even my kids would go where I go to, because I'm a patient at Mbagathi, I have it over there, and at least I have my personal doctor. Chair, the issue of maintenance is important, which is why, and now we're moving to the level 4s. The introduction of CEOs in level 5, a CEO looks at the 360 degree of a hospital. From how does the gate look like? How is the signboard? How does a watchman speak to Mwananchi when he comes in there? Are they welcoming? Is there a reception? Is there signage that shows you directional mapping? Doctors are good, but they focus more on medical and clinical and technical issues. So that has helped us do some, well maintenance. If you come to those hospitals, you will see the gardens are taken care of. The quality of paint, the aesthetic, even the aesthetic value, the food. They look at what the patients are getting, etc. And we've seen huge improvement. And now at the level 4s, we are soon advertising for also those facility heads of that nature that can look widely. Because our level 4s have realized in Nairobi almost like a level 5 elsewhere, because of the sheer number of people that they see. So that is what we intend to do.
Thank you, Your Excellency. Honorable Chair, the sharing formula was determined after several considerations. We sat down with the FEDA and we also worked on his return on investment, and we have transferred some risk to him, like other than the installation of the machine, he is doing the maintenance of the equipment, including updating of relevant software and other physical infrastructure, ensuring the parking area is clean, and such other things. So it will subsist for a period of 3 years, then we'll do a review. Honorable Chair, thank you.
Thank you very much. At least the period is fairly good. So, Senator Kamau, there is only one more question that asked about how many people are registered in SHA in Nairobi County.
Yes. On SHA, we have 2.9 million people now registered in Nairobi. That is 42%. And so we keep telling them, *147# register, join SHA. Even the short code has the county number of Nairobi, 47. So we are the biggest champion because it's really helped our facilities, especially at the primary level. Chair, just as a by the way, or maybe as a diversion, when we are here, people are watching us, and somebody has sent me a message asking for money to go for radiotherapy at a private hospital. I want to tell him, it's called Tobias, go to Mbagathi, and you will receive that service the same way we're being treated there. I've just seen that message on my SMS, Chair. Chair, we humbly submit.
Thank you very much. Maybe, honorable members, if there is anything else other than what was on the statements. So thank you very much, Governor. The last time we made a visit to Mbagathi and the Nairobi funeral home, and the funeral home was not in a good state. All the generators were not working, all the fridges were not working, so I hope there is improvement.
Chair, in fact, one of the issues we had asked was, Governor, I hope you've solarized all your health facilities.
Not all of them. Solar is expensive, so we're looking for partners. The initial cost of setting it up is a bit high. So we've been able to do some markets. We are looking at the facilities if we can do through FIF, because we don't want to pump in more money in hospitals while they're actually receiving money. The markets don't receive money, that is comparable.
So I was just saying, Governor, when we visited the Nairobi funeral home, there was a huge problem. So maybe just in a nutshell, tell us the improvements we have done. We noted that the generator was not working, the fridges were not working. We had also issues of staffing in that place, and I'm happy now that KMTC is now training mortician. One of the problems that we had was it has to be training on the job. But now KMTC is training personnel, so I don't know whether you have improved the number of personnel. The few are there were complaining about the workload. And the other thing that was a problem in Nairobi Funeral Home are unclaimed bodies, and also bodies that are brought by the police. And I actually made a recommendation that there is need to have a separate problem mortuary because of the nature of Nairobi and the issues of crime and all these unclaimed bodies. It is completely necessary to have a separate mortuary to handle issues of police, because the bodies are kept there for years and before the matters are concluded, and if they are mixed with the regular bodies where families come to take, those staff there specifically made that request that their work would be made easier if they are dealing, with the issue of normal bodies from facility and so forth. But the ones that have police issues, should actually be kept in a separate place. So maybe you can just make that. But otherwise, I want to say thank you very much for. Yes, Senator Amida.
Just a second, just one question. I was just wondering on mental health. Do the morticians and maybe all the people that handle these bodies, are they taken through mental health? I mean, are they taken through counseling and all that? And the one last thing, I mean, it is really important. But one last thing is that one last thing is about medical equipment. I hope all equipments, working at this time. The medical equipment is quite thorny. You know it, Gaba. Thanks.
And I encourage all of us who are here, for purpose of mental fitness, it's good to once in a year you visit a mortuary. It wakes up. It will help you wake up to the reality that do something when you are still alive, because.
Chair, when you see my CEC who's next to me, who is the youngest CEC in this country, when she became CEC for health, I told her the first thing she must walk through the city mortuary from one end to the other end. And she was at first timid but became very bold. Even I got used to it. I think I've gone there more than any other leader in this city before. And I keep going. If I pass by Bagadi, I always pass by the funeral home. I know those young ladies who you met. At that time, there were 14 of them. We've onboarded them. They have come on board. We've hired also some casuals. Senator Hamida, morticians love their job and they really enjoy their clients. Their clients are not rude. The clients don't complain. They don't talk back. If you ask doctors, the chairman of Nairobi Funeral Home is Dr. Johansen Odo, who is one of the highly acclaimed morticians in our country. And if he tells you stories of what he's dealt with, it's a calling, When I was in Chiromo, in campus, the medical school students would also start in, Chiromo and our school of math. And in first year, many would drop out because they start with pathology, where you have to go work on the cadavers. By the time you've gone through that, and you end up working in the funeral home, it is something that you're good with. But I hear you. If actually for all our staff, wellness is available for them. It is in the insurance cover. We encourage them, and we have our own county councillors. One thing we realized was many counties, and it's something we dealt with when I was here as chair of labor. Many counties didn't have in their schemes of service provisions for clinical psychologists, psychiatrists to be hired. So many counties didn't have that component. We changed that, and even as Nairobi, we've had very many, counselors, psychiatrists, facilities. You find that service available. And I want to encourage senators here and colleagues, because Chair, in the first time I was here in 2013 as an MP, we didn't have that in our medical scheme until one of our colleagues had an issue. And when she had this issue, she stormed the speaker's office and said, "Why is it that my psychiatrists cannot be paid? Because they are not on insurance." When that was introduced, it became the highest sought service by parliamentarians. So I hope you're also taking it, because it is okay not to be okay. And we did that book last year with them in the last Senate with Senator Sylvia Kasanga about mental health. Chair, on the issue of Nairobi Funeral Home, by the time we went there had been a challenge with the coolers. We've increased the number of coolers. There are 10 new coolers in Nairobi Funeral Home. The issue of disposing bodies has to go through a court process. We have to go to the courts to allow us, and we put the list in the paper. It's very expensive. But in the last financial year, we've been able to dispose 1,000 bodies from Nairobi Funeral Home. I really like the idea that you've given, that a special facility be set up purely for those cases that are from crime or police cases, etc., because they're treated differently. And that's a conversation we can have. Because, it reached a point that my chief officer refused to receive bodies from the police, and now the bodies were kept in a truck. Now the police boss tells me he has no mortuary. What does he do? Because they don't pay, For all other people, there's a payment that is done. But for the cases that come from the Kenya police, they do not pay. And so we said, let's find an arrangement between ourselves and the national police, because they don't provide such health services, but they can help us construct, or we can construct a facility that those cases can be dealt with in the manner they're dealt with. And I want to thank you for that idea. The issue of medical equipment is something we chose as a city, as a county, not to rush into it. There's a national equipment program, which is a good initiative. You know, we had earlier the MESS program, which became a mess. So 45 counties signed. Nairobi didn't sign, and Kiambu had not signed, because we wanted to look at the detail of each contract and what we were already receiving. In some of the instances, we had better deals in terms of the revenue share of placement. We have since been able to negotiate. And so what we are signing as Nairobi, and I have already authorized for us now to sign, is a specific tailor-made program based on what Nairobi needs. So that you don't sign for what you don't require. Remember, there are countries that had signed, they were being charged, the money was being withdrawn from COP, yet they don't have three-phase electricity. So they're not using equipment that they're paying for, or they don't have water connections. So just being prudent and making sure that we get value for money. It has taken us time to refine all of those contracts and to have a tailor-made requirement. You'll find there are certain machines that are needed in Islands, maybe near Dandora. You'll find more respiratory issues than in Dagoretti. There are certain issues that are actually, in as much as Nairobi is small, there are very different ailments. Mbagathi has a huge population of people coming from Kajiado that come to Kajiado County, that come to Mbagathi, and what they come for is very different from what people are being treated for in Roysambu. So in fact, that's why I've found land to construct a proper level 5 along Magadi Road. So the Ongatarongai population, which I still consider my population really, because they're here throughout the day, they just go there to sleep, can also have a fully fledged level 5 facility along Magadi Road, just after the Catholic University. So Chair, yes, these improvements are being made day by day. We are not yet there. We are not perfect, and no county is, nobody is. But I'm very proud of what this team has been able to do. I'm proud of my team. And whenever they have challenges, they come and they consult. We've made great strides. I think the ICU example was a very stark comparison. From zero to the numbers that we have, we need more. But we will put together a proposal, Chair, that I will present to your committee on the affirmative action that Nairobi needs with respect to healthcare. And I'm sure that you'll be able to support us. Thank you, Chair.
Thank you very much, ladies and gentlemen. I think we stop at that. So this meeting stands adjourned. We shall be visiting, definitely. And Governor, most of the time for purpose of Nairobi, because we are all usual residents of Nairobi, sometimes the requirement of notice is not necessary, because it's about service delivery. So we shall be making quite several impromptu visits to your facilities. And our work is to give feedback on what needs to be done to where. So just take note. Mbagathi, of course, Mama Lucy, from the last report, we had asked you to take some, the recommendations we had made. So we are also coming there to check whether you act on our recommendations. And that entirely lies on the facility and the boats. Otherwise, ladies and gentlemen, thank you very much.
Yeah, the only issue of notice is not for time, but so that you have the right people. Nairobians, you can find someone and he says he's the CEO, yet he is there for mental health issues. And he takes you around and gives you a report. So just so that you have the right people in the right hospitals, just tell us, even if it's one day.
No, we shall tell you, but it will be part of mental treatment. Not walking around will also be a way of relieving pressure. Asanteni sana.